If you're a member of GBUACO, and that could be a physician that's part of it, or the staff, or patients, click on the app. We put a lot of work into doing this. So within GBUACO, if you want to find a doctor that's part of our network, you click on that, and then you can actually put the doctor's name. I'll put Dr. Vasquez at this point, and the category, which is primary care, family practice. And when you do that, what you end up doing, and you hit the search button, it'll actually pop up who the doctor is and all the information that you can interact to kind of go out and see the provider that you want. One of the things before I get into, we do push out information. So on the top, you've seen like a little envelope. When you click on that, it has information of a lot of things that we want you to kind of know. That could be triggered as you come into the building or you leave the building. So if there's mammography available today, you're going to get alerts. In this particular case, the top one, and you hit open, it was a neurologist, that Dr. Nicholas, that is doing a lot of medical minutes related to chronic diseases to kind of tell you how to really manage the condition. But multiple things we sent out. The other thing is on the right side, the Your Care incentives. These are like, as a member at GBUACO for this particular program, if you have this screening done, you qualify for a $25 gift card. We made a little bit of emergency line, so God forbid something occurs, you can click on that, and you have access to poison control, suicide hotline, domestic, and all you've got to do is tap any of these, and the number actually you can call right out of the app. So it's integrated that way. The health encyclopedia, which is really important, is if you click on it, you can actually see, we've given you all this stuff, and it's all for free, and it's all sort of compliant. So it's good information. A lot of times you search the web not knowing if the information is accurate or not. This is actually accurate. So if I hit DA, I can actually look at different things, and I want to find out about asthma. If I click on the asthma component, I get a nice description of what asthma is. And down below, if I hit the interactive tutorial, it's actually going to take me, and you'll hear it, to a little film on this. And I hit continue, and then I hit continue. Now what ends up happening is you'll actually get a whole instruction.
I understand that this education program includes general information and not...
And when I hit that,
asthma
now you go through the different triggers, and it'll describe it to you, which is actually pretty good.
Press the right arrow to continue.
So these are things that you want to kind of learn from that could be beneficial to you. The other things that we also tied in is the medical minutes, which are on the bottom, which could be part of the update. When you click on them, you're actually seeing information related to different things in healthcare that we feel patients need to know. Because of GBUACO, we're trying to really improve care so that patients are getting the care, even if they don't show up at the office sometimes. So telehealth, if you click on it, will tell you the things that we're trying to do with telehealth, which is really trying to really manage a lot of things in the home that we normally do in the office. So it's almost like a virtual clinic. So we are going out to you, and the nurses are helping to bring the doctors to you. And so you call, and they figure out if you need the doctor, how to get the doctor on a video system to be able to kind of manage you. Now, in terms of community resources, very important. If we hit community resources, a lot of stuff is out there. One of the areas that I want you to kind of focus on is the neighborhood navigator. If you click on that, it takes you to this nice site. And when you're looking further down, let's say you put a zip code of 14201 and hit search, it looks for things in your area. And why that's important is if you need housing, you click on it. If you need temporary shelter, it will actually look around your area and then give you the locations to kind of get services. That's real important. And the other side is 211. If you go to the 211 homepage, again, a lot of the stuff that you need, whether it's health and wellness, whether it's mental health, substance abuse, food, and nutrition, are all resources around you. And we just want to make sure patients are aware of that. We have a handbook for if you're a member of GBUACO, which this handbook will actually give you all the services that, because of our contracting with the insurers, you're entitled to. When you come down to the further areas, there's for the providers, we have the compliant training, which is a system here, but we're making sure that all providers and the system are compliant. And this is our way to kind of really try to improve that area. About Us will take you to the GBUACO website, and you'll have more information about what GBUACO stands for, how we're trying to change things, and really redesign the way healthcare is being delivered today. The YouTube channels, if you click on it, will actually give you a lot of programs and things that we've done in the past, so you can keep up. And it's actually very good to kind of learn of what we find on the events, talking to some providers, talking about telehealth, and just our organization, some of the things we want to do. You click on the annual report. If you do this, it's actually something we put together every year to show how well we've done. And the annual report will show you that we've actually saved the system a lot of money, and patients have done very well as a result of that. And all the accreditation. Patients are satisfied, and as part of GBUACO, we're only one of 4 NCQ accredited ACOs that have that certification, and how we did on our quality metrics compared to state and federal numbers. And I think go through this so that you see the type of quality we're trying to deliver for you. In terms of feedback, always important. Feedback, we want the patients, the providers to tell us how we're doing so that we can change or improve anything we have to do. Contact on the left, if you click on the contact component, if you need to get the main number to the GBUACO, nurse line, transportation, if you click on the nursing section, you're going to get a number to make it a lot easier for you to navigate through our system. In the news will be a lot of things that we are doing in the community and partnering as an ACO with different agencies to really try to get patients better care. The NCQ accreditation I talked about is here, and again, we're proud to say that we have that accreditation, only 4 in the country. Our locations, if you hit the location, it'll show you the sites we have right now for the ACO in terms of the services we want to deliver. We have the events, and these are different things that we do within the community, and you'll be notified more and more as we do more of these events. Social media, as always, we want you to join us. On the bottom, you have a lot of medical minutes, so if we have like Dr. Gales that's talking about hypertension, you can hit on the bottom and you'll get a discussion on that. Again, all this stuff is just trying to make you guys get the best information